Welcome to the Ultimate Nurse's Quick Guide, Nursing Documentation and Legal Protection. Every day, nurses make hundreds of clinical decisions. We assess patients, administer medications, communicate with providers, and respond to subtle changes that can mean the difference between recovery and deterioration. But no matter how excellent your care is, one reality remains true. If it isn't documented, it can be difficult to prove that it happened. This audiobook will help you strengthen one of the most important skills in nursing: clear, objective, and legally defensible documentation. Whether you're a nursing student, a new graduate, an experienced bedside nurse, or preparing for your licensing exams, these practical lessons can help protect both your patients and your professional license. Let's begin. Chapter 1. Documentation is a legal record, not just notes. Many nurses think of documentation as simply another task to complete before the end of a busy shift. But in reality, every note you write becomes part of a permanent legal record. Long after a patient has been discharged, your documentation may be reviewed by physicians, hospital administrators, risk management teams, or even a court of law. At that point, the medical record becomes the only evidence of the care you provided. That's why nurses often hear the phrase, "If it isn't documented, it didn't happen." This doesn't mean your care wasn't excellent. It simply means that without documentation, there's no way to prove what you observed, what actions you took, or how the patient responded. Good documentation does more than record completed tasks. It tells the patient's clinical story. It shows what you assessed, what changed, what interventions were performed, and what happened afterward. It allows every member of the healthcare team to understand the patient's condition and continue safe, coordinated care. Instead of writing vague statements like "patient stable," describe exactly what you observed. Objective, specific documentation provides a much clearer picture of the patient's condition and demonstrates your clinical judgment. Remember, documentation isn't just paperwork. It is communication, professional accountability, and one of the strongest forms of legal protection a nurse can have. As you continue through this audiobook, you'll discover practical strategies for writing documentation that supports patient safety, strengthens teamwork, and protects your professional practice. Let's continue to Chapter 2, where we'll examine some of the most commonly used words in nursing documentation, and why seemingly harmless phrases like stable, normal, and no complaints may place both nurses and patients at unnecessary risk. Chapter 2. The most dangerous words nurses use. In nursing, the words we choose matter. While phrases like stable, normal, and no complaints are commonly used, they often lack the detail needed to accurately describe a patient's condition. What seems like efficient charting today can create confusion when the medical record is reviewed later. For example, documenting that a patient is stable raises an important question: stable compared to what? Without supporting assessment findings, that single word provides very little clinical information. Instead, describe what you actually observed. Document the patient's level of consciousness, respiratory status, vital signs, pain level, and any other relevant findings that support your assessment. The same principle applies to words like normal. Every patient has a unique baseline. A finding that is normal for one patient may be abnormal for another. That's why objective, measurable data are far more valuable than general descriptions. Another phrase nurses frequently use is no complaints. While it may seem appropriate, patients don't always volunteer symptoms. Some minimize their discomfort, while others may be unable to communicate effectively. Rather than relying on this phrase alone, document both what the patient reports and what you observe during your assessment. Strong documentation is based on facts, not assumptions. Instead of writing, "Patient appears anxious," describe the behavior you observed, such as pacing, restlessness, or repeated questions. Rather than documenting "patient confused," explain exactly what the patient said or did that demonstrated confusion. Objective documentation paints a clear clinical picture. It helps other healthcare professionals understand the patient's condition, supports continuity of care, and provides stronger legal protection should your documentation ever be reviewed. As a general rule, chart what you see, what you hear, what the patient tells you, and what you measure, not what you assume. In the next chapter, we'll discuss one of the most important principles in nursing documentation: why failing to document an assessment, intervention, or reassessment may legally be interpreted as though it never happened. Chapter 3. Failure to document equals failure to act. As nurses, we perform countless assessments, interventions, and clinical decisions throughout every shift. But in the medical record, only one version of care exists, the one that is documented. No matter how thorough your care was, if it isn't recorded, there is no evidence that it occurred. This is why healthcare professionals often say, if it isn't charted, it wasn't done. Imagine that you recognize early signs of patient deterioration. You assess the patient, notify the provider, continue monitoring, and respond appropriately. However, if your documentation simply states, patient resting comfortably, anyone reviewing the chart may assume there were no concerning findings and that no action was necessary. The problem isn't the care you provided, it's the absence of evidence. Documentation gaps are never viewed as neutral. During legal or clinical reviews, missing assessments, undocumented interventions, or absent reassessments may be interpreted as missed care, delayed recognition, or failure to act, even when none of those assumptions are true. High-risk situations make complete documentation even more important. After administering medication, document the patient's response. When a patient's condition changes, record what you observed, what actions you took, and when those actions occurred. If you notify a provider, include the reason for the communication, the time, the response received, and your follow-up assessment. Strong documentation tells the complete clinical story. It demonstrates your assessment, your critical thinking, and your professional judgment. More importantly, it provides continuity of care for the next healthcare professional caring for the patient. Before completing every nursing note, ask yourself 3 simple questions. What did I observe? What action did I take? What happened next? If your documentation answers those questions clearly, you've created a record that supports patient safety while protecting your professional practice. In the next chapter, we'll discuss why the timing of your documentation is just as important as the information you record, and how late entries and back charting can affect both credibility and legal protection. Chapter 4. Charting late and back charting risks. In a busy healthcare environment, documenting in real time isn't always possible. Nurses often respond to emergencies, care for multiple patients, and prioritize immediate clinical needs before returning to complete their charting. While delayed documentation can happen, how you document those delays is extremely important. Timing is a critical part of the medical record. Every assessment, intervention, and provider notification contributes to a timeline of patient care. When that timeline is unclear or inaccurate, it can raise questions about whether care was provided promptly. Late documentation is acceptable when handled honestly and transparently. If you're documenting after the event, clearly identify it as a late entry and record both the actual time the event occurred and the time you're entering the documentation. This preserves the accuracy of the medical record and demonstrates professional integrity. In contrast, back charting, recording documentation as though it was entered in real time when it was not, is considered a high-risk practice. Even if the clinical care was appropriate, altering the timeline can damage the credibility of the entire record and may be interpreted as falsification. If you discover an error in your documentation, never attempt to delete or conceal it. Instead, follow your organization's approved correction process by using an addendum or correction feature. A transparent correction maintains the integrity of the medical record and reflects professional accountability. Before signing your documentation, ask yourself 3 questions. Does my timeline accurately reflect what happened? Can someone unfamiliar with this patient follow the sequence of events? Have I documented honestly and completely? Accurate documentation isn't just about recording the right information, it's about recording it truthfully and in the proper context. Clear, timely, and transparent charting strengthens both patient safety and your professional credibility. In the next chapter, we'll examine another common documentation risk in today's electronic health records: copy and paste notes, auto-filled templates, and how convenience can sometimes compromise accurate patient documentation. Chapter 5. Copy-paste and template charting errors. Welcome to Chapter 5. Electronic health records have made nursing documentation faster and more efficient. Templates, auto-filled fields, and copy and paste features can save valuable time during a busy shift. However, these same tools can also introduce significant documentation risks when they are used without careful review. The greatest danger isn't using templates, it's allowing them to replace your clinical assessment. Every patient is unique, and every assessment should reflect the patient's current condition. Copying a previous note without verifying today's findings may result in documentation that no longer matches what is happening at the bedside. For example, a patient who was alert and oriented yesterday may become confused today. A patient whose breathing was normal during the previous shift may now be showing early signs of respiratory distress. If yesterday's assessment is simply copied forward, these important clinical changes may never appear in the medical record. This type of repetitive documentation is often called cloned charting. During audits or legal reviews, identical nursing notes across multiple shifts can suggest that the patient was not reassessed, even if a thorough assessment was actually performed. Templates should always serve as a guide, not a substitute for observation. Before accepting any pre-filled information, verify that every finding accurately reflects the patient's current status. Update changes from baseline, remove outdated information, and ensure that your documentation is consistent with the patient's vital signs, laboratory results, and overall clinical condition. Remember, documentation should tell the story of today's patient, not yesterday's. Before finalizing your chart, pause and ask yourself, did I personally assess these findings? Does this documentation accurately reflect my patient at this moment? Would another healthcare professional understand the patient's current condition based on what I've written? Technology is a valuable tool, but it should never replace professional nursing judgment. The strongest documentation is always individualized, accurate, and based on what you personally observed at the bedside. You've now completed the 5 foundational principles of safe nursing documentation. In the remaining chapters, we'll build on these concepts as we explore objective charting, patient deterioration, provider communication, patient refusals, emergency documentation, real-world case studies, and the practical habits that help nurses document with confidence while protecting both their patients and their professional practice. Thank you for listening to this preview of the Ultimate Nurse's Quick Guide, Nursing Documentation and Legal Protection. I hope these opening chapters have given you valuable insights into one of the most essential skills in nursing: clear, accurate, and legally defensible documentation. Remember, every assessment you perform, every intervention you provide, and every patient you care for deserves documentation that reflects the quality of your professional practice. Because in nursing, excellent care doesn't end at the bedside, it continues through every chart entry you make. The complete audiobook expands on these principles with all 16 chapters, practical documentation strategies, real-world case studies, clinical examples, and actionable guidance that you can apply on every shift, whether you're a nursing student, a newly licensed nurse, or an experienced healthcare professional. I'm Mary Jane Millionaire, registered nurse and author, and it has been my privilege to share this knowledge with you. If you enjoyed this preview, the complete audiobook, along with the Kindle and paperback editions, is available on Amazon. Simply search for Mary Jane Millionaire or The Ultimate Nurse's Quick Guide, Nursing Documentation and Legal Protection, to continue your learning journey. Thank you for listening, thank you for your commitment to safe nursing practice, and above all, thank you for the care you provide to your patients every single day. Until next time, stay curious, keep learning, and remember, every patient has a story. Every chart tells that story. Make sure yours reflects the excellence of the care you provide.